recording as well. Dr. Samir Parikh is a very distinguished psychiatrist and has played a significant role in enhancing the image and reach of mental health across the country. He completed his MBBS and MD in psychiatry from Civil Hospital Ahmedabad and topped the university in both. He is the director of Department of Mental Health and Behavioral Sciences Department, which is at the Fortis National Mental Health Program, to which he's the chairperson as well. One of the very few comprehensive multi-city, multi-centric mental health care program in the world, with a team of over 80 experts at 20 centers across Delhi NCR, Mumbai, Bangalore, Chennai, Kolkata, Jaipur, Amritsar, Mohali, and Ludhiana. The work done by department has reached 15 crore lives, which is a phenomenal work which Dr. Parikh and his team have been doing. Without any further ado, I will hand over the proceedings to Dr. Parikh, and at the same time, I will welcome each one of you to this discussion. And before I hand over to you, Dr. Parikh, I just wanted to quickly share a statistic with everybody here, which again, for me was piece of my information while I was trying to do a little research, is that as per the National Crime Records Bureau, which is NCRB, and this data is for 2021, India's suicide rate is at 12, which means country saw an average of 12 suicides per every 1 lakh population, totaling approximately 1.65 suicides in 2021. I'm given to understand that when I read the data again, that in 2022, this data point increased by 4% as such. And one of the points, because we're not just discussing about suicide, keeping in mind the student, we're actually discussing the overall topic of suicide, which is a very, very important topic. 8% of the above data point, which I've shared with you, all suicide were among students as well. So I believe Dr. Parikh will have better answers, or in fact have better data point than me, but this is what I read. Correct me, Dr. Parikh, if I'm wrong, but I hand it over to you now.
Important, very, very important conversation, to be honest. When I was reached out for this conversation by Gaurava, I said yes instantly, because I fundamentally believe that this is a conversation which needs to be happening year on year, year after year, especially pre-exams and even more so post-exam results. Directly or indirectly, everybody here is an educationist. You don't need a psychiatrist like me to tell you that there is significant stress that is there on young people. And the fact that exams very much are a part of the stressful experiences that young people have. And we cannot take the fact away that we do live in a world, in a society, globally, where we are losing young people to death by suicide. And that's something that we have to understand. Park this thought, which is reality. Does the number matter? What percentage? How many people? If it's my family, your student, somebody close to us, just imagine. Loss of a life in itself is a loss. There is no way to even describe it. Loss of a young life. The impact of that is absolutely different. And now loss of that life to something as meaningless in the context of longitudinal axis of life like marks is something all of us should reflect upon. So that's why this conversation is important. And I believe this is a conversation we should have a lot, many more times. If you are an adult, if you are in any which way associated with young people around you, then you are a stakeholder in suicide prevention. You don't need a mental health professional to drive suicide prevention. You don't need forums like IPN to remind you about suicide prevention. You don't need to be a school administrator to do something more. Everyone has to do this. Suicide and prevention, these two words should always be thought about as almost like one word for all of us. Never allow yourself to think the word suicide. You think suicide prevention. What does that mean? That means if there is a death by suicide, I, we, us failed at prevention. Because suicide is preventable. Until we nail this in our brains, that suicide is preventable, we will not realize the importance of the role we have to play in suicide prevention. And that has to be our goal. I will come to various aspects of suicide prevention, but I first need you to mention this thought process in your mind. Suicide prevention. If a death by suicide happens, then we have failed in providing for the support. No excuses, but we failed. Whether we talk about a young school-going student, whether we talk about a student in a coaching institute, whether it is in a college, whether it's a young working adult or anyone for that matter, there is no age. But the fact is, globally, concerns around adolescent suicide or young people's suicide is increasing. Don't allow yourself to believe that this is an India problem. This is a global problem. But what can we do is the only question we ask ourselves. What can we do? How do we understand? What language we use? What support we give? What prevention techniques we have? What crisis intervention we do? What are those aspects? And as educationists, what can we do? So I'll try and take you through this spectrum through the next 10, 15 odd minutes, and then we'll take a freewheeling questions on this. So let's start with this. Lots of times when you hear an individual's loss, among the first mistakes we make, why did this happen? We try to find what we can understand as the immediate trigger. What we don't understand is, look at life in a longitudinal axis. There are distal factors which are impacting an individual and proximal factors which happen around this particular incident. So first look at the longitudinal factors. Longitudinal factors means I may be a 15-year-old and I have been struggling for the past 8-9 months. The struggle could have been academic. I was struggling in my exams or my unit tests. I kept on getting scoldings, reprimand, marks issues, parents, tuitions, and I continued to struggle. Or I had a few blackouts during my exams, panic attacks during exams. I can't sleep before an exam, which means around exams, I go through this intense stressful arousal, which should have been a red flag for somebody around me, teacher, peer, senior, parent, guide, mentor, tuition teacher, whoever, to identify that there are certain aspects around exams which give me stress. So if I start working on it now, which is 6 months, 7 months before, till I keep taking one exam after the other, today, if I have an exam, I'll approach it with less stress. If the result does not go my way, I will know how to deal with it better. So longitudinal, proximal. Longitudinal, it was happening for a while. I did not get the skill set and the support. Proximal, I had a bad result. Or longitudinal, I've been having some mental health concerns, anxiety, depressive illness. I'm just looking at 2 examples here. I've been struggling. I've not got the support. So when I go through a stressful episode, my coping ability has been reduced drastically by this longitudinal axis, that I'm not able to know what to do. Third aspect, I may be having a longitudinal axis where my environment gives me stress. Environment could be home, where I may be having concerns around interpersonal relationships, or finance, and be very, very clear, financial pressures also have their own impact, including on teens. I will not be touching much upon this because we are talking about young people, but I want to make it as emphatically clear as I can. I do believe globally all societies need to have some kind of financial security means for people who struggle with finances to be able to bring them out of crisis, because globally the struggle about death by suicide because of financial reasons is also a concern. And that's something we should probably think about at a policy global level, something that's food for thought. Coming back to the longitudinal and proximal. Longitudinal, I'm going through bullying at school. WHO 2022 report mentions bullying as a significant aspect of stress which can result into considerable mental health concerns in years to come as an adult. We should honestly, with humility, sincerely accept we do not have schools or colleges which are bully-free. We are trying, I'm sure, to have bully-free schools and zones and colleges, but we neither have the virtual world bully-free in the cyber trolling world, or nor do we have our physical spaces safe enough where bullying is not happening. And yes, we should do something about bullying without any doubt, including as a part of suicide prevention. Now let's look further. Social aspect. I'm struggling with friends. I'm struggling with relationships. I'm struggling with a support system. And when I needed help, I didn't have the access to a support system because I didn't think I could reach one because I was struggling with relationships. All of these things I mentioned should have been identified and worked upon, which is the preventive aspect. So how do you bring prevention to this longitudinal axis? Study and exam skills need to be taught again and again to school children. You don't teach them only subjects, you do study and exam skills also. When you are giving them study and exam, especially for your senior students, you also talk about what to do around the day of exam, what to do when results happen, whom to reach out to. Share with them not only the helplines which are available, also create your own little helpline support system for exam results and during exams, because kids know you, they have a trust on you. They'll reach out to you a lot more easily, something that we need to look at. So skill building when it comes to study and exam skills and results. Skill building, which is also around social communication related skill building, so that young people learn how to deal with the pressures. And I feel all teachers in schools need to be trained on psychological first aid. I'll be happy to work with each of your schools through IPN, and maybe we can dedicate 1 year into training more and more teachers on psychological first aid, Let's create this together, do a joint initiative. Let's target 5,000 schools in one calendar year where all teachers are trained in psychological first aid. 5,000 schools, we start with year one. Why can't we do that? Why? And why should we do that? We should do that because if a teacher is trained in psychological first aid, the teacher becomes trained in identifying with students struggling, learning how to deal with it, and linking to a solution. Look, listen, link. Look, identify, listen, empathetic, non-judgmental, non-reprimanding talk. Link them to a solution, be it a counselor, be it a psychologist, be it a teacher, be it some extra classes, be it some sports, so on and so forth, right? So that's the approach we have. Skill building on exam and study, skill building, psychological first aid for the entire teacher community, and we can do this together. It's not very tough. But let's say we decide together that from now on, every alternate Friday, for example, like today, we meet and every school, we pick up 3 schools, 4 schools, city-wise, take 1,000, 2,000 teachers and keep doing it, keep doing it. Keep cheese, that's a chisel for us, right? And let's move forward with this. You add on more. Do not deny the impact of media and the narrative around suicide. Even today, you will hear the word committed suicide. Notice how I was talking about death by suicide. Understand the connotation makes difference. Committed, I'm not committing to suicide. Death by suicide, right? Why do we say use the right language? Because language has an impact. It's a social learning. In fact, I'd encourage all of you to read the guidelines of reportage for suicide. You will realize there are guidelines that you do not mention methodology, do not sensationalize, do not mention the last few words, do not mention the note, do not hypothesize. More importantly, every time you report on suicide, mention all helplines which are available in that population. Also mention the solution, mention the emotional loss component. Why is this important? Because if you don't do this, the concerns are around Werther's effect. Werther's effect, which was years back also called the copycat suicide, which means when I hear about suicide, I'm a 16-year-old. I heard the death by suicide of another 16-year-old. I feel that person's reason and my reasons are same. I feel what that person did, I could also do. That happens. It's a reality. Something called the Werther's effect. Opposite of Werther's effect is what is called the Papageno's effect. Papageno, the famous Mozart play, The Magic Flute. Young Papageno says, I don't want to live. Papageno's friends take Papageno around and show this is the world. See, this is nice. That is nice. By the end of the play, Papageno realizes life is nice and beautiful. So the peer support can make a difference into feeling life's not good to life is good. And the impact of media, which is Werther's, based on Sorrows of Young Werther, a very, very famous book that saw a lot of young people and the copycat component happening late 1800s. So look at these two aspects. Now, you and I can't control what is being said or reported, given that media is no longer conventional print or visual media. It's also social, where you may not govern what is being said. That's where media literacy comes into the picture, which means we train our children, our teens, on how to develop media literacy, ask questions, don't take things on face value, think what is right, what is fake, what is true. So that aspect of education needs to be there. Psychological first aid, media literacy, anti-bullying. We need to create bully-free schools. We need to create anti-bullying squads. I've been saying this in all our workshops. Don't be a bully, be a buddy, bully to buddy. So if you and I need to work together to make bullies into buddies, because the bully needs help, the student who was bullied needs help, And the students who were observing, the bystanders, they also need help. All three of them need help. Now, the other aspects that need to be seen, what makes me more vulnerable? I'm more vulnerable if I perceive that my family is disappointed or will be disappointed if my marks go up and down. Second, my friends will stop being friends with me or they will feel something about me. Third, in comparison to my friends, because of the way the world has become a world of likes and views and numbers, I'll feel inferior about myself, worthlessness. Or I'll feel because I have not done well in this exam, it could have been my 12th, my future is not good, hopelessness. I mentioned worthlessness, hopelessness. And third, nobody can now help me. I've continuously failed. The world is not going to be fair to me. Helplessness. So if I feel worthless, hopeless, or helpless, I'm vulnerable to taking an action out of the disappointment that I am experiencing. What do you do? Worthfulness. How do you make me feel worthful from worthless? Sports, creativity, social relationships, recognizing my strengths as a part of my 8, 10, 12 years of education, how much good my school, my education system, my parents were able to make me feel. That one mark, one exam does not define me. I say this again and again. For those people who are watching an IPL and are knowing the World Cup to happen, can a Virat score a century match after match? Is Virat never going to get out on zero? How is a zero different from an exam that went poorly? So does that mean I don't play again? Did Tendulkar not score centuries and zeros? Why don't you do Google and see how many zeros Sachin Tendulkar scored and how many centuries? That is the answer to making you feel worthful and not worthless, which is how it needs to happen. Hopelessness. How do you bring hope? You make people realize, young people, one exam, one mark at the cross section, how can it ever have an impact on your life? You didn't ask me what were my marks in 12th before this session. You didn't ask me what were my marks in medical college. You didn't ask me whether I passed out in one attempt or 50 attempts. You didn't ask me that. Because it stopped mattering after a while. It mattered at one moment in time only to open a gate or two. But that doesn't mean that a 98 and a 97 made that big a difference that we perceive it does. Because it doesn't. So you bring a sense of hopefulness or hope, take away the hopelessness. And the last is helplessness. There is robust evidence globally that 3 in 4 people who struggle with mental health issues do not seek help because they feel stigma, they feel the fear of discrimination. That's why they don't seek help. Your and my role is to encourage young people from seeking help. You tell them, go talk to a friend anytime. You talk to a senior. Pick up a phone, talk to your teacher. Make sure you share everything with your parents when you are struggling. Talk to a cousin. If or these are the helplines, but you encourage help seeking behavior. So worthlessness, hopelessness, helplessness, the 3 aspects which take you to that cross section from life is beautiful to life I don't want to. If you and I work on a longitudinal axis, we'll be able to reduce what happens in a proximal trigger zone. This is one part of it. The second part is, because this is an ongoing process we have to do, what do you and I do now? Identify which students are disappointed. Those who are disappointed, based on your own understanding, reach out to them. Make sure you talk to them. Tell parents what not to say and what to say. Be unconditional, encourageable. Explain them when exam doesn't matter. Show them real life examples where how a poorer result of an exam did not change that person's life because they worked hard the next time, learned from it. Make sure the social component of life, which is friends and cousins and family, does not get impacted because of the result. So the self is not compromised. Give them a path. Okay, now you do this, now you do that, so that in a few weeks' time or months' time, things will be on track. By doing all this, you bring hope, you bring worthfulness, you give help. So those three things don't happen. And you share helpline numbers. You encourage, do what we call in our branch as crisis intervention. Identify the person in crisis, tell them what is the solution, handhold them till they find and reach the solution. Reach out. Crisis intervention is probably the only areas in psychological intervention where you have to be proactive, you be directive, be prescriptive, you handhold until you've navigated the person out of that situation. So that's how we need to look at it. Use the right language, bring media literacy, psychological first aid, study and exam skills, and keep working on mental health. I feel in years to come, mental health curriculums in schools need to be encouraged. I do feel that when it comes to exams, we need to keep working on study and exam skills so that schools become more, you need to empower children to be able to navigate the stresses of their life. But they can't if you don't give them the skill. And life skills application into real-time problem solutions is the way forward. And that's the only way to look at it. And at the same time, encourage help-seeking behavior. Don't make them feel that mental health is a stigmatized word. In fact, for all of you, especially if you have students in grade 11 and 12 who are taking psychology, I am taking an internship, online internship, I think next week, 6 days in a week, row, 1 hour every day, but I'll be teaching on various aspects of psychology. Feel free to ask them to join in wherever you are in the country or outside. Feel free, but encourage mental health. I hope most schools have psychology as a subject. It's something that will bring more positivity. I also feel that your counselors interact a lot more with students, and you give them the space to keep meeting more and more students, especially in group situations. And I feel that more and more parents and teachers need to come together, work together on this. And no sensitive, responsible civilization cannot feel extremely awful about its own self if it loses even one young person to death by suicide. There is no, I can't put it in any other way. It is what it is, and it should hurt where it should hurt. It should hurt me that why were we not able to save a life which had so much of potential. It should hurt you. There is no other way. So before I take questions, my very simple few things again as a revision. Don't look at death by suicide as what happened on that day only. Look at what did we miss for a long time. Understand the importance of the narrative and nature of communication. Understand certain aspects like worth, hope, help, psychological first aid, media literacy, bullying, study and exam skills, parents and teachers working together. These integral aspects need to be there, and sharing information and raising the bar of mental health awareness. All of this is a part of suicide prevention. And especially keeping on sharing helplines that you can with students. And let this be, let just be a reminder that however much we try, it's not a headline, it's not a number, it's not a percentage, it's just a colossal collective failure every time we lose a life. I'll take questions.
Absolutely well said, Dr. Parikh. In fact, it's a shared responsibility. No two ways about it. Very passionately said, in fact, and you suggested an idea. We would love to do that with you. We will support you in whichever way we can, which is we can take this initiative of yours to every school possible who are keen to do it, which we will work out. Absolutely no two ways about it. For now, what we'll do is we'll open the house for Q&A, which is that give us a virtual show of hand. We'll help you unmute and you can either share your experience or you have any question directly for Dr. Parikh, you can do so. Yeah. We'll start with Chehek, your question. Please go ahead.
Good evening, sir.
Good evening.
Sir, my question, as I am a counselor and we are counseling almost 22 students per day, like we are 3 counselors in our school, and we have a tradition of calling each student for 3 times or sometimes twice in a year. Sometimes we encounter that few students are having suicidal tendencies. So, how to clarify within ourselves that whether these suicidal tendencies are real or the child is just trying to seek the attention of the teachers or students or even parents also?
Ma'am, my answer is very simple on this. I would never ever look at any self-harming thought or expression a young person gives and try to look at a categorization. I will treat each one of those expressions as a red flag. There is evidence about this that individuals, when they share about self-harming thoughts, those individuals in the future are more likely to also act on it. So what
Yes.
I do is I will give this child more regular time, understand what is bothering this child. Even if I feel that the intent may not be very high, but I will still see the verbalization as a significant aspect and I will work on it if need be with parents, if need be with external experts, if need be with school teachers and peers. But I will try and bring some of these things together and I will ensure that the triggers which are acting on this child, I'll start working on this. The mere fact that I will start addressing them and working on them would in itself be start bringing hope in this young person, which will reduce that this whole aspect of life is not nice.
And sir, do you think meditation works for such kind of people like those who are having depression or they have a startup of anxiety or they have certain suicidal tendency? Are they able to concentrate while doing meditation?
Ma'am, I don't think we can club all of these as one. In the sense, if somebody has depression, we'll need to see it as a clinical aspect. So
Yes, sir.
typically, if there is depression, mild to moderate, you are looking at psychotherapy, moderate to severe medication. Along with that, yes, lifestyle would from physical activity, meditation, peer interaction, sports, art, all of them have their own role to play. But to say that any one of them can substitute the evidence-based guidelines, that wouldn't be correct. Similarly, if it is stress, then yes, it will be different. But a clinical illness would be very different. So we'll need to look at it more specific.
I'll just go in continuation to this question, Dr. Parikh. There's a question in the chat as well with Madhav Ahuja. Are there any specific expression, body language, or communication which represents that a person or a child is having suicidal instinct?
So it will not be an instinct. Let's start with that. Rather than looking at the word suicide here per se, let's look at more signs of distress. What would be the signs of distress? Change of behavior, distress in emotion, distress reflecting in academic performance, distress reflecting in, let's say, even absenteeism, distress resulting into change of behavior in terms of either getting irritable or withdrawing from people, sleep appetite related changes, mood changes. If this distress is there, I start working on the distress. To say that distress A may result into self-harm and distress B may not is conjecture. You resolve each individual's distress, automatically you are working on that longitudinal axis. Because I learned through your efforts that if I'm struggling, there are solutions. So next time when I need help, I won't hesitate to seek help.
Correct, absolutely. So I think, Amita, your question.
Good evening, everyone.
Good
My
evening.
question to Dr. Parikh is that I know a few children who have stammering issues. So these children, because of their stammering issues, though they are brilliant in studies, but because of the stammering issues, they are not able to perform that well, especially when it is a verbal communication. And also, because of this issue, they get depressed and they sometimes talk about what is the use of life, and they feel that they are of no use in this world since they can't talk properly. So I want some remedies to help such kind of children if it is possible.
No, we'll have to look at again some of these things separately. Like I mentioned earlier, um, depression needs to be seen as a clinical condition with guidelines and very clear clinical interventions from psychotherapy to medication. When you are looking at other aspects, whether it is stammering as an illness or whether it is other forms of concerns that young people have. It could even be related to an experience of bullying or body shaming. It could also be an experience of pressure that is of conformity coming because of social. Lots of pressures come on children, which can sometimes make them feel more inferior. Coming back to what I said during my conversation, worthlessness. So if a young person is feeling worthless because of reason A, I need them to feel worthful because of B, C, and D. And I help them work on A so that the what is perceived weakness can start reducing by working on it. But strength is always identified by young people, which has to be a goal.
Thank you so much, Dr. Parikh.
Samarjit Das Gupta, your question, please.
Am I audible?
Yes.
Yes, you are. Go ahead.
Good evening, sir. Good evening, Dr. Parikh. You see, I am stating something that has just happened today in my office, and I would like to take the discussion back to our homes, to the homes of our students. You know, I feel with my experience in the field of education that the crux of all these mental health issues start at home. Now, today I had the child of my school who ranked third in the school for the board exams. And the parent came with me with a request about re-evaluation of board papers because the child scored 89%, 89 in SST, and as per the mother and the child, did not score the highest, that is 100 on 100. Was saying that my child got 11 marks less, and that's why we want a re-evaluation. Now, there is a process from CBSE where the re-evaluation would start from the 20th, and I did explain that to the mother and the child. So is it not that we start this whole movement?
We lost you, Samarjit. We're not able to hear you.
I'll respond to what you were saying.
Sure.
I said it at the start. I fundamentally believe in it. Everybody is a stakeholder. I'm not going to reduce my responsibility as a clinician. Let's say Gaurava can't reduce his. Neither can a principal, nor can a teacher, nor can a parent, nor can media, nor can social media. We all have a role to play. And if we are not in this together, it will fail us somewhere or the other, because that's where the net is all of us together. Any one piece going down, that's a big wide gap. That's the only way to look at it. So, but at the same time, I typically don't like to say that where the problem is more or less, because I think it's a more of a collective problem. And whether it's coming more from one direction or the other doesn't change the fact that we need to find a solution. Because sometimes when you talk to parents, they say the problem's coming from school. Sometimes when you talk to schools, they say parents coming problem, and so on and so forth. So I think what we can do in the given limitations at times that we have, but what we can do has to be our approach, and how do we bring more people in it together, including parents. I think that's the way to look at it.
Shalini Singh, your question, please. There are a few questions which are coming to me on the chat as well, ladies and gentlemen. I'll try to cover as much as I can. We are first taking questions which are coming to us, which are directly coming to us through a virtual show of hand, right? Shalini, your question, please.
First of all, good evening. I would like to discuss one of the things that has happened with me. One of my very childhood friend, she is also a teacher right now. She has taught in, I think, 3 to 4 schools. She has been dealing with dual identity disorder, and somewhere she has this tendency of suicide. So she always talks to me about various things, depression she has been dealing about. And as a friend, I always listen to her. I always advise my best way, the way I can tell her to be motivated, to stay positive. But somewhere I also, feel there is some lackness there where I could not help her properly. So I just want to know how should I deal with her so that she stays positive, because she whenever she joins any school, after 2 to 3 months she resigns. The main reason of it is because somewhere her anger issue comes up in the school in front of all the teachers or all the students. So I just want to know how I can motivate her so that she remains positive, and also she's very, very smart. So she continues to teach because she has this potential of making a difference. But somewhere due to this problem, due to her mental health conditions, she is not able to do what she actually wants to. So I just want to know how can I help her?
How further can you help her?
So, frankly, the way you are helping is good enough at the level of a friend. But if you are talking about something which is a continuous mental health distress, then frankly, the right thing to do is to introduce her to a mental health professional.
She has been looking, but she has been seeking help from a doctor, but there is no, so far, positive change.
So sure,
Yes,
and that can happen. But if, let's say, help has not come from one avenue, we look at another avenue. But the role of family and friends is to give unconditional support, be there. But
sir, also, one more thing I would like to ask you, that because she always calls me and speaks her problem to me, is it really okay if I always listen to her problem? I tell her the solution, but is it really okay to always listen to her problems as a friend, or should I try to ignore it so that she also feels that it is not such a big problem if I'm not listening to her as a friend?
no, I don't think friends should not be listening, and I don't think friends should be deciding whether a problem is small or big. If somebody is reaching out to us, then we should ideally give unconditional support. Having said that, for somebody struggling with mental health concerns, must be encouraged to seek help from a professional also. Friends will have a role to play, significant as it is, but sometimes we will also need the experts to do that. If you feel one intervention through one expert's approach for a significant period, let's say at least an 8-10 month period, has not really worked, one can look at alternate approach. But both would be required, which is support of friends and family, and the expert intervention. In this case, I think expert intervention needs to be looked into.
Ms. Madhuri Arora, your question. You'll have to unmute. Yeah, Madhuri.
Good evening, sir. Good evening, sir. Sir, first of all, though, it is a good initiative. We are going to get help from the sir. Sir, my question is ki there are many students I see in social isolation in schools because they are confused about their gender orientation. Because this is the we can see many students they are confused about their orientation, personality, and they keep themselves in social isolation. So as sir said, it is active failure ki we are not able to guide and decide. So how schools and parents can help in making them comfortable in their gender orientation or accepting them as they are with their whole heart? How we can create an awareness society?
I think we need to create a society which is inclusive. I think a society which is non-judgmental, equity, equality, and inclusivity. That's the way to look at all environments, and all environments need to be safe from, not just safe in terms of physical threats that happen in society. It's also about social and emotional, verbal and judgmental, so on and so forth. And I think the way to look at it is working closely with teachers and parents, and bringing some of the aspects which bring out our sense of stigma, bring out discrimination from people, and put pressure on young people as they are growing, and make sure that we give them a non-judgmental environment where they're able to grow. Inclusivity is frankly non-negotiable.
I'm taking one question, Doctor, from the chat, which I caught my attention as well. How should schools deal with teachers having mental health issues, as they are further responsible for so many other children?
Like how any other mental health issue would be there. I mean, a school teacher is a working adult. 10 to 15% of working adults, if you look at the global data, suffer from mental illnesses, and they should be given help. You could have been a medical professional. You could have been a professional of any kind. How would you have approached diabetes? How would you have approached thyroid? How did you approach COVID? How would you approach typhoid? How would you approach a seizure disorder, a migraine, blood pressure? I can go on and on. I mean, a mental illness is an illness at the end of the day. The individual should get the right medical and psychological support. And based on the level of functionality, the highest level of functioning should be maintained, and unconditional support should be given without any sense of discrimination.
Absolutely rightly said. We have another 10 minutes. We need Dubey, your question.
Good evening, Jain sir.
Please go ahead. Push your question.
Yeah. Is talking about suicide threatening to kill yourself is just applied to get attention? In most of the cases,
I don't feel like that, sir. On the contrary, like I mentioned, verbalization about suicide has been correlated with death by suicide, and has been correlated with multiple attempts of self-harm. So I would not see it like that. I would see, as a mental health professional, when an individual talks about thoughts of death or dying or thoughts of harming themselves, I would treat it very, very seriously and try and give them support. The verbalization is also, to me, a sign of seeking help.
Okay, sir. Thank you.
Sutapash Sinha, we will send you, or there is a question which is regarding the psychology students, as in that internship which you are doing. We will get this emailed to you as well, the details of this internship, and you can then directly reach out to Dr. Samir's team. Sutapa, your question. Please go ahead.
Okay, sir. Actually, my question is, though you explained that how to make a student feel that thoughtful, but still many cases where I teach 11th and 12th students, I find them that they can't hand the failures. They can't control. Because what happens if you see the syllabus of 10th grade and 12th grade, there is a huge difference. And many times they struggle a lot to cope up with everything. So the student who performed very well in 10th grade, sometimes I found that 11th and 12th grade, they are not doing very well, and they go under utter distress, and they feel that worthlessness. So how to teach them that they can handle their failures as well?
No, I think what you're saying is right. If a young person by 15, 14 is struggling with the ability to deal with disappointment, that's because for the past 10, 12 years, when we were teaching this young person various subjects, we probably did not give enough attention to the subject of life, where you also learn how to navigate life. Now, when we identify that this individual is struggling, whether it is because of academic pressures or a change of scores and marks, we address that, help this person identify where they need to go through change, and then support them with that. There is no other way to look at it.
Swati, your question?
Very good evening, sir, and Dr. Parikh, sir. My question are back-to-back two questions. First of all, what is ADHD? And my second question is, recently I felt in my school is, we all know that today it's a brimming of coaching society. Coaching culture is brimming very well in our society. So one case that it came to my school was, in my school, a girl who scored very well, but she was adamant to get admission in a coaching center. So the father came to me that he wants that my daughter wants to, attend non-attending classes, but she wants to get admission in this and that coaching center. When I explored the idea that she was brainwashed by the teachers in the coaching center, so how come we can get the solution? Because this is not the one girl, but the entire society is now fascinated by these coaching centers. So my question it goes to, what is the solution of, because father spoke to me and he asked me, ma'am, what can I do for my daughter? Because if there is a threat that she is on the risk that she can do anything, so I have to do anything what she is talking to me. So this is my question, that how come we can turn these youth from these coaching center kind of problem, sir?
First one, ADHD, attention deficit hyperactivity disorder. We are looking at a clinical condition where individual will have attention concerns, hyperactivity, impulsivity. It's a medical illness. Treatment may be medications, may be behavioral therapy and correction, but needs to be seen as a clinical problem, not as a non-clinical problem. It's not a behavioral problem, it's a medical illness. Expert intervention almost always is advisable in ADHD. To the second part, I think one needs to understand, when a young person wants to do something that they believe is going to help them in their career, we should ask ourselves why and what made them feel like it. So if a young person says, I don't want to go to school, but I want to go to A, B, or C place, and my career will become better, this is an information reached this person through various vectors: advertisements, direct approach, peers, seniors, community, so on and so forth. If there is misinformation or semi-correct information, you fight it with correct information, consistent correct information. What is it that makes a young person feel that the education I take in school may not give me the desired result, but the education which is done outside the school at the cost of not attending school give me that? The other aspect, the boards, the guidelines around attendance are very clear, because someone somewhere is okay with saying don't take the school and you can still get the attendance. We are creating a perception that rules don't apply to everyone. That also is faulty learning. So the only way to correct learning is not merely talking to one individual. It's looking at what can be done at a collective level. I don't believe in all good and all bad, that things are only good or only bad. For some people, certain things will work, for some they will not work. But I do feel that mainstream schooling has a significant role in being in creating the a proper formative aspect of our life, and that's something which is unique. And everything is not about how many hours you study. It's also how do you build your skill set and your personality, because navigating life is not about how many marks you got. There's a lot more to life than marks. That's a fact we can't deny.
NK Tyagiji, your question. We have last 3 minutes. We'll take a couple of questions. NK Tyagiji, and then we'll take Arpit Tripathi as a final question, please. Tyagiji, you'll have to unmute yourself, please.
Am I audible to you?
Yes, you are. Please go ahead.
Yeah. Good evening to you and Dr. Parikh and all the participants. Sir, my question is based on psychological terms, and Dr. Parikh, I do hope you'll be able to respond to me, being an expert on the subject, that a term is there in psychology that is known to be a stadium vitae, weariness of life. And that is said to be the major reason for producing that kind of extremity in the heart of a child to take such an extreme step when he does not meet out his desires or whatever he is estimating himself to be deserving. So what is the major reason behind that type of tendency of stadium vitae, that weariness of life, that compels a child to take such an extreme step? And how could it be identified and tackled with? If Dr. Parikh could be able to, just put into limelight into that. Yes, sir.
State of helplessness. World is not just phenomena. World is not a hopeful place. Life is not a hopeful experience. I will not get help. I don't have worthiness. It is these kind of aspects which make me feel what I feel in terms of life. Now, these I could feel because of multiple factors. Clinical factors like depression as an illness, social factors in terms of peer relationships, or academic factors in terms of performance-related feedback, non-academic performance factors, which could be related to other areas of our functionality, social factors added on with terms of social media, aspects of bullying, aspects around a family environment, aspects around how I feel about myself, what kind of positive feedback I have consistently got about me from various vectors in life. In absence of that, if I don't get enough positivity, I'll not be only able to generate positivity from myself. I will also need some triggers and sources to be able to do that. That's why, like I mentioned in my session, one needs to start in the longitudinal axis, understand the various aspects of what I was talking about. Each one of them has to be worked upon. In isolation, none of them would.
Right. Thank you.
Arpit, your question. Arpit,
good evening. So I have good evening, sir. Am I audible?
Yes.
Yeah. Go ahead, please.
I have two questions. The very first question is this modeling learned helplessness. That is something which is, like nowadays I'm finding it learned helplessness, and another issue is FOMO. So if you as an expert can advise over it.
So I tell young people there is no, I mean, what is FOMO? I mean, what is it that will miss out that will be so important? There is nothing, right? It's been created by the narrative around us. For example, you open a page and you will see that there is an X show, which is binge-worthy show. How can anything be binge-worthy? Binge is negative, worthy is positive, negative, positive can't be put together randomly. But you are forcing a young person to say, you see this show 8 episodes within a night. Then they will not be able to sleep that night. Then they'll have an impact the next day, and so on and so forth. Most of this is about narratives. And that's where the concern is. Schooling 30, 40 years back was in a closed narrative where outside vectors did not have much impact. So schools had a lot more ability to empower young people. Today, school is a droplet in this large ocean, which is also throwing in lots of information, largely incorrect and sometimes unreal or fake as well. In that situation, we will need to understand that education will have to also evolve itself. Then what all do we educate in terms of the context of life? So, for example, when I was talking about internship, I actually talk about social as well, social media as well. I, in fact, have a segment on self in the world that, yes, I will teach you clinical diagnosis, I will teach you psychotherapy, I'll teach you how to do community mental health, but I also teach you that how do you deal and navigate life. Those aspects also need to be looked at.
Perfect. I think that is all we had. In fact, the time we had with us, everybody. Thank you very much, Dr. Parikh. Completely out of time. We will do two things as a priority, which is we will get all of you emailed the session as in the details of this internship. I have got the form from Dr. Parikh, which we will send it to you, number one. I have also got a request that we would want that mental health first aid kit for teachers to be organized. We will get that worked out with Dr. Parikh and team and see how can we plan that. Obviously, we'll work out with their convenience and timing. So on that note, firstly, a huge thank you. We can give Dr. Parikh a round of applause while I've been reading the chat already. There's a huge amount of feedback coming in. If at all we have missed out any of your question, absolutely, you'll have to pardon us purely because I usually give preference to questions which are coming through a virtual show of hand. You get all these chats actually are too many to really read and gets a little overwhelming at times, right? So if we have missed out, apologies. I think Dr. Parikh is very, very approachable on social media. You all can actually directly reach out to him as well. He's very, very approachable there, and he obviously will love to take up your question, which are in the right direction at any point in time as well. For now, thank you very much. Have a great evening, all of you. As far as our discussion or whatever are the takeaways, we will work out something with Dr. Parikh and his team, and we will keep touching such, in fact, issues which are around mental health with the expertise of the Fortis team and under the leadership of Dr. Parikh. That is our endeavor, as we'll keep doing, in fact. So while we took a break and we did after a long time this session with Dr. Parikh, but if you all follow our work, we do a regular monthly session with Fortis team, which is organized every month, in fact. So if you can follow our social media handles, ours or even Fortis Mental Health's social media handle, you will get all the information for that matter. You join there, you join here, absolutely no problem. That's the way it should be. This is all we have to spread as much as we can. Thank you, Dr. Parikh, once again. Pleasure meeting you and having you with us. And we look forward to see you very, very soon. Take care, everybody. Bye-bye.